So we're going to go over some selected skeletal muscles across the body, kind of talk about locations and functions, and we're going to be looking at this horse picture right here, and this is going to have most of these muscles lined out on it. Some of them might not be on here, but we can discuss where they're at. And there is a limited amount of muscles that we can actually list on this, so there's way more muscles than what we'll have here, but these are superficial and on the surface, and they can have clinical importance, like areas we give injections to, muscles that are easily felt, and we can take notice if there's an injury such as a muscle tear that would lead to conditions such as lameness. The first muscle we're going to talk about is just underneath the skin, and it's called the cutaneous muscles. This is going to be over the thoracic area in the abdominal area mostly, but it can extend up into the neck and back across the hip too. And so these are muscles that are just right underneath the skin. They attach to the dermis and they give a muscle twitch. And what they're there for is if something lands on the animal, and you'll see this, like if a fly lands on a horse and goes to bite them, you will actually see them twitch their cutaneous muscles. We do have them as primates, and they do twitch on us a little bit, but not as much as, say, a dog or a horse will do, or a cow. And part of the reason is we have, as primates, have arms to swat away flies, and those animals do not, so they rely very heavily on these cutaneous muscles. Cutaneous muscles, chelae, do not really attach to the skeleton. They're just attached underneath the skin and allow for that twitch. Starting off at the head and neck, we're going to start off with the masseter muscle. The facial muscles, and there's more than just the masseter, end up controlling things like facial expression. They help in mastication of food, opening and closing the jaw. And the masseter is this really thick muscle right here that we see, and its main job is to assist in chewing and to help close that jaw when you're doing the chewing action of crushing and grinding. Going back into the neck, we have the splenius muscle, which attaches to the pole down here to the top of the thoracic vertebrae, and the trapezius muscle, which acts like a trapeze. It actually helps to suspend the scapula and hold the thoracic limb on by attaching to the top of the thoracic vertebrae here, and actually also attaching up here to the ligaments that actually hold up the neck. And its job is to actually help to support the head. Both of these together help to support the head and hold it up. They help to raise the head up, and they give support to different structures in the neck and along with the shoulder. Doing things like moving the head laterally is something that the brachiocephalicus muscle does. It, along with the serratus ventralis muscle, so right here is the brachiocephalicus, and then this is the serratus ventralis. They both have a job in actually pulling the leg and the shoulder forward, extend it to help pull that leg all the way forward when it moves. The serratus ventralis also is part of what they call the thoracic support. It kind of helps to support keeping the scapula and the thoracic limb attached to the axial skeleton. And then its true clinical significance in horses is this is where we give, and also in cattle, is this is where we get a lot of intermuscular injections. So this is where we give a lot of IM shots, is actually into this serratus ventralis muscle. Sternocephalicus, this actually attaches to the cervical muscles and down here to the manubrium of the sternum, and this actually is very important for flexing and bending and pulling the head down. Abdominal organs are very important because they help to support the abdomen. They help to flex the back. They're important for doing what we call an abdominal press, which is used to help in defecation, urination, parturition, vomiting, and regurgitation. So the muscles will actually help to press the abdomen in assistance with any of those functions of the digestive tract. And then they also play a role in expiration of the respiratory system. Key muscles to know of are going to be the external abdominal oblique, and these are actually seen here on the side of the horse. The internal abdominal obliques, which would be deeper, and these actually crisscross each other, running in an opposite direction from each other. The rectus abdominis runs down the midline, and that's what people would know as your six-pack abs. And then the transverse abdominis is the deepest and actually runs in the direction of dorsal to ventral. All of these will meet on the very ventral midline at an aponeuroses known as the linea alba. And all these muscles together do all the functions of supporting the abdominal ingesta and contents, and then doing what we were talking about, flexing the back and assisting in expiration of air. Now to the thoracic limb, we're going to look at the muscles here that are involved with locomotion and some of the different roles that they can play. Adductor muscles, these are muscles that actually pull the limb in to the midline, the latissimus dorsi, which actually attaches up here to the lumbar and thoracic spine and goes in here up underneath the shoulder, plays a very key role in actually doing that, pulling the leg and the limb in. It also plays a role also in moving forward with extending and flexing the shoulder. The pectoral muscles, so it's known as your pecs, they do the same thing. They actually help to bring the limb in, and they also play a role in moving the shoulder too. The pectoral muscles can become important in large animals, especially in horses, because some people do give vaccinations and other shots in the pectoral muscle. Deltoid muscles are out here laterally, and they actually abduct, so they actually pull the limb out to the side. Once again, they're going to be working on the area of the shoulder and doing that, and they also play a role in extension and flexion of the shoulder. But they're actually out here on the side, over top of right behind and over top of the scapula. Next, when we look at the brachial muscles, the muscles that play a huge role in actually moving the elbow and flexing and extending it, the main flexor is going to be the biceps brachii muscle, which would be up here. And then you have your triceps muscle, which is your main extensor of the elbow. We don't actually do any shots into the biceps. There is the radial nerve and the ulnar nerve runs in that area. And if you try to give any shots in that area or any intermuscular injections, you can easily damage those nerves and cause paralysis to the limb. However, the triceps is used by some veterinarians in small animals, especially in dogs and cats, to do some injections, IM, especially in small amounts of medicine. So I do know veterinarians that have used the triceps for doing like vaccinations in dogs or giving low doses of, say, antibiotics, IM, in cats. Going down more distally on the leg, we have the flexors and extensors, and they have some names such as the common digital extensor, which runs on the front of the leg and extends the digit going down the center. The extensor carpi radialis and flexor carpi radialis. These are muscles that actually run on the inside of the leg and are important in actually extending and flexing the digit. And then the deep digital flexor muscle, and this is actually going to be on the caudal side of the limb and actually runs down and turns into the deep digital flexor tendon. And so this right here is really important for actually picking up the foot and flexing the digit. Pelvic limb, some of the muscles that play a very important role in moving the pelvic limb are going to be the gluteal muscles. And so the gluteal muscles are up here on the hip, and they're very important for actually extending and flexing the hip joint. We have the hamstring muscles, which are very important actually down here. They have it of the hip, and they do play a role in flexing, extending the hip. They also play a very important role of actually moving the stifle, and actually also play a role in moving the tarsus in the hamstring group. So what you would call your hamstring running down the back of your leg, and that's going to be the biceps femoris, semimembranosus, and semitendinosus. What's key important about these is underneath the biceps femoris lies the sciatic nerve, so we never do an injection in the biceps femoris. However, when we do intermuscular injections in the pelvic limb, we're always coming back here to the semimembranosus and semitendinosus, are the main two muscle groups that we actually put intermuscular injections into. Extensors of the stifle is going to be the quadricep muscles, so it's going to be here the more cranial muscles, and it's a large group of muscles right here is the quadriceps group. And then going down here to the tarsus, some of the main ones on top of the hamstring group that ends up playing a role in moving the tarsus here too is going to be the main true flexors and extensors down here into the digit are going to be things like the long digital extensor, the gastrocnemius muscle, and the soleus muscle there. And these can actually, on the gastrocnemius and the soleus muscles, these will actually turn into what's known as your Achilles tendon. So they're actually the tendon that would come around back here at the calcaneus and go down and flex the digit. Muscles of respiration. So very key muscles involved in inspiration and expiration are going to be the following. For inspiration, it's going to be the diaphragm and external intercostal muscles. And for expiration, it's going to be the internal intercostal muscles and the abdominal muscles. The muscle that does greater than 95% of the work in normal resting respiration and does the majority of the work even when exercise is occurring is going to be the diaphragm. And so the diaphragm does 95% of actually moving air in and out in the normal patient at rest. The external intercostals actually play less than 5% of opening up the airway for inspiration. However, when we look at exercise, they do start to pick up a larger role as tidal volume of the lungs increase. So the amount of air coming into the lungs, they will start to play a larger role in inspiration. Expiration at rest is primarily a passive exercise by actually relaxing the diaphragm. Most of the air is expired out. And there's a very small amount of action that the internal intercostal muscles and abdominal muscles will do in expiratory processes at rest. With exercise, the amount of use of these muscles goes up greatly. And then when we get into illnesses where we need to try to force air out, say like with asthma, these muscles become key and very important in using. Important thing to know about these muscles, expiratory muscles, is they do fatigue much faster than the inspiratory muscles, which means that if we have patients in respiratory distress and they're having problems exhaling air, it's very key to treat them very fast because these expiratory muscles do not have near the stamina for use that, say, the diaphragm and the external intercostal muscles have. So that was some key muscles across the body to know about. Next, we're going to go into looking at microscopic anatomy and cell physiology of muscles and muscle and contraction.